Hello, I'm Kerry Dueholm.
And I'm Kerry Raymond.
We're two of the counselors with D2 Counseling in Dallas, and we were very happy to be asked to give some opinions and answers on some questions that you all submitted, and we hope that we can be helpful with your time.
One of the questions that was submitted to us that I think is really applicable to a lot of the women and a lot of moms. The question is that I recently saw an article where a woman talked about working so hard to get a leadership role and thinking she could enjoy her success, but instead found herself working even harder. How can we enjoy our success?
Mm-hmm.
So that's a really good question with people that are moms
mm-hmm.
and have worked so hard and moving up. And really success is kind of defined by what you make it, right? Mm-hmm. It's success could be successful in your career, in your job, making a difference to others, in your family. So I think one of the important things is just kind of looking and defining what success means to you. Mm-hmm. So does it mean in a position or obtaining a certain dollar amount? Time management, organizational skills, and stress management are all character traits and things that you learn as you're building it through your career. Mm-hmm. So sometimes I feel like we could be stuck in, we want this. We have our education, we have our experience, and we have little kids. Mm-hmm. And really we want to be at a certain place. So even small things that we can do, and with the mindset that that's going to help us as we get more advanced in our career. So such as helping our children be more independent, mm-hmm. Trying to figure out time management, delegating things. And so as we do that, and then we get more of a leadership role, then I think that can help us to be able to juggle everything.
Mm-hmm. Good. And I think over time, sort of how we feel successful changes, like you said, mm-hmm. and also sometimes priorities have to change.
Sure.
Yeah, to find satisfaction.
Right, right. Yeah, and as you're growing in your career, involving the family. Mm-hmm. Asking your spouse and your children and saying, okay, I have this opportunity, but this is what it will bring the family. Mm-hmm. But these are some of the things that the family is going to need to do to help contribute.
Sure. A related question that we got, there are two that were similar. One was, how do I deal with mom guilt, especially right now when the kids are home doing virtual school and I'm working full time and get frustrated when the kids don't do what they're supposed to do. And I lose patience. That never happens to me. And also, I'm feeling very overwhelmed and exhausted with my workload and school at home. How do I balance it all together? So one thing that I read recently was actually an interview with author Nora Roberts. And she was asked how she balanced all of the writing that she did and raising her children. And she said that the key to juggling is knowing how to decide that some of the balls you have in the air are made of plastic and some are made of glass.
Oh, I like that.
Yeah, and so being able to decide all of these demands that we have on ourselves, which just increase over time and have absolutely increased in the last 6 months, if we've sort of all become home educators and spend a lot of time with our family, which can be a mixed blessing. As we've dealt with all of these different balls and then sort of trying to get back to some semblance of normal, deciding what's a plastic ball and what's mm-hmm. a glass ball, and then which one you can let drop. Mm-hmm. It's a big challenge, but I think it's a good way to think of it. And so, is this work project a glass ball or a plastic ball? Sometimes. And is the kids' sports practice a plastic ball or a glass ball? Well, sometimes. Mm-hmm. And the key is also to remember that balance doesn't mean that we're balanced in the same way every day. Some days will be big work days. Some days will be big family days. Mm-hmm. and giving yourself some grace if it turns out it's a couple of work days in a row, or it's a couple of family days in a row, or whatever it needs to be for your welfare, your family's welfare, and your professional welfare as well.
And that seems to be a good point about giving yourself grace.
Yes.
That's really important
Mm-hmm.
because, you know, I heard it also said that you can have a piece of cake and eat it too, but you can't have the whole cake.
Right.
And so just recognizing what you can do,
Mm-hmm.
offering sympathy or empathy with others.
Mm-hmm.
Everyone has joined this Plano's Moms group,
Mm-hmm.
which is a fantastic way to connect with each other,
Mm-hmm.
offering suggestions and having a place to express your feelings.
Mm-hmm. So another piece of this that I would recommend is having achievable expectations. 150 years ago, if parents felt like they had done a good job if the kids were still alive at bedtime. But now that we've added to all of that, these expectations we have for ourselves and for our kids, social emotional learning and all sorts of things, which are good things, but there's still a lot of pressure. So give yourself a break, have achievable expectations. You're doing great.
That if kids are still alive at bedtime reminds me of, I have twins and they were born preemies and very sick, on heart apnea monitoring. And I really struggled with, I love them both. Both are hungry right now. I can't feed them both.
Right.
And so I had to get down to the basics of if they're crying, they're breathing. Because there have been times when they haven't been breathing.
Sure.
So if they're alive at bedtime, then that's a good thing.
Yeah,
we
definitely.
do need to sometimes just bring it down to the bare. I remember clearly saying to myself when they were crying, saying to myself, it's okay, they're breathing.
Yes. Yeah, absolutely. Absolutely.
Tagging on to that a little bit is a question about how do we support someone who's struggling? And I think that's a great question right now, because even while we are struggling ourselves and we see other people struggling. So how do you support someone who's struggling, and then also you feel like you're struggling as well? And sometimes I think you can probably appreciate this as a therapist. We don't have it perfect.
No.
We have lots of
not at all.
stress. And something that I hear a lot of people say is, if I'm challenged with that and I don't always make the right decision, how can I support someone else or help them make the right decision, because I might be a hypocrite? So I think supporting someone when they're struggling, just allowing that space, balancing between empathizing with them and listening, doing active listening skills, and not forcing the issue. So if they don't want to talk about it, or if you plant a seed or suggest something and they're not ready to water that seed, okay. So giving them that space, trying to determine whether you need to be a listening ear or if they want to help with problem solving.
Sure.
That's a big balance. And again, I think as a therapist, we both have to determine that. Do they want a listening ear or do they want problem solving right now?
And sometimes I'll even ask my friends, do you want advice about this?
Right. That's a great way. Yes.
And sometimes when I am coming to my husband, I'll say either I need help with this problem or I'm just venting. And that's sort of before I even start discussing what's going on. That way he knows which way to listen. So.
That's an excellent strategy. Asking for what you need for that time.
Yeah. And I think it's to be expected that at certain times we'll be doing better and other folks will be doing worse, and that's okay. And when we have more gas in the tank, or whatever metaphor, we can share. And when we need help, asking for help is not a sign of weakness.
Right.
So a related question was, what signs should I be watching for with my kids? And I think that's a question we have across the lifespan. How do we know what's normal, struggling? I have a 12-year-old, so he's got all the feelings, and is a wonderful child. but what's normal and what's outside the range of normal. And so sort of a guideline for that is any change that's outside of the range of normal for that particular child. Of course, we all know each of our children is different, and what's normal for each child is different. So if it's out of the range of normal and also persists, we all have a couple of days every once in a while where we're moody or some situation is bothering us, but it's that sort of duration and also impact. So how disruptive is it to their well-being? So if it's kind of gone beyond 2 weeks, I sort of encourage parents to wait it out for 2 weeks and see how it's going. That might be when it's time to talk to a professional. A pediatrician is a great place to start.
Yes.
Just in case it's a physical something or other going on,
Right.
they can rule that out. They might, I know my kids have been seeing the same pediatrician for a long time, so they have that history with them. And so you know your child, you know what's typical for them. And also, it's been very common for kids to have regression through these last 6 months. My youngest started sucking her thumb again, something she had not done for about a year.
Interesting.
Yeah. No big deal, but just my mom radar went up. And another one had some trouble sleeping. Some of the symptoms we've seen with our clients who are younger, anxiety, angry outbursts, that behavioral regression, which could be sleep or thumb sucking or bathroom issues.
Defiance, wanting to leave the home, taking their frustration on the restrictions, safety precautions, taking those frustrations on the parents. You are keeping me home.
Right.
So maybe helping them to reframe the way that they're thinking. You know, you won't let me go out. I know it's really tough. I want to go out as well.
Yeah,
it's
absolutely.
Hard right now.
Affirming the feelings.
Right.
I think that goes a long way to making people feel heard.
Asking open-ended questions.
Yes. Yeah. What would you do if you could leave the house? And then sympathizing with that. I would love to go do a lot of things. So sort of with the watching for your kids, it's sort of what's different than before, how long has it lasted, and how disruptive is it?
Great. Okay, one of the other questions that was asked by us was a question related to a little girl who's deathly afraid of dogs. Her grandparents are going to be getting a dog. And the question was, how do I help my daughter be able to still go visit her grandparents? Because she has said, I'm not going to go see my grandparents if they have a dog. Afraid of dogs, I'm not going to go there. I think that this question, and the little girl in this question is 4.
Okay.
So I think that although this is about dogs, it could very easily be related to a lot of things that those little preschooler, younger children are going to dig in their heels.
Right.
Developmentally, they're at the age where they realize that they can make a decision. And they realize, oh, I can make life really hard for mom if I am not going into that store. So, well, maybe going to the store is a different example, but not going to go to school.
Or whatever. Yeah.
Or that they're very afraid of something. Afraid of the dark. We can substitute that with a lot of things. So I think that the asking them to talk about that, we have to kind of recognize where we're at, because if our child says, I'm not going to go there, then we might automatically feel like, oh my gosh, what will happen? They'll never see my parents ever again. They need to. So putting that aside and opening up the conversation, you know, what is it about dogs that you don't like? What are some, you know, I don't like them jumping, I don't like the barking, I don't like the licking, helping them decide what they don't like. I love how now we have so many stories and books, I think, about everything. Actually, I even Googled this, and there's a sweet little kid's book called I'm Not Afraid of Dogs.
Oh, timely.
So, yeah. So I think that there is like a book almost for every example. So getting them used to talking about it. What do they not like about it? And then watching, then kind of desensitizing a little bit.
Right.
Watching videos or watching, you know, a Facebook clip about cute little dogs dressed up in costumes. Maybe lots of cute videos of babies and dogs I've seen.
So sort of thinking of the steps it would take to get her comfortable.
Right.
Baby stepping up
Right.
to meeting
Right.
the
And
granddog.
then the grandparents talking to the little girl
Mhm.
about, we have this kennel, this is a safe place for the dog,
Mhm.
and then just allowing her to come over and putting the puppy in the back room.
Mhm.
And then periodically bringing the puppy out to have the puppy just go potty or something, and just slowly exposing.
Yeah.
Helping her to feed the dog, helping
Mhm.
her to name it, or having her help to name the dog.
Mhm.
Just getting her more involved.
Yeah. Great. Another question we got was, with all this negative COVID, how can I get my positive outlook back? Things slowed way down this summer, and I'm used to super busy work and being busy at work and home. It's probably better to be less busy, but I feel a need to be super productive like before. So a couple suggestions. The first would be to be aware of how you're measuring productivity and how that has to change in the current world. I was thinking about when I had my first child and I was home with him for a few weeks, and I would feel like I had done nothing all day. And then I would really make a list of it for myself, because I like to have a lot to show for the day. And I would think, well, I fed him 800 times. And I changed his clothes a couple of times. We went for a couple of walks. I fed myself. And you just sort of don't notice how much you're actually doing. So sort of thinking of what we're achieving in a different way.
And what the final outcome is for that.
Yeah.
Because I know that when I have been just in a really down mood, if I say, well, I brushed my teeth today, is like, big what, who cares?
Sure.
But brushing my teeth is going to promote healthy hygiene and long range health for myself. And so I'm feeding my child. What are you doing while you're feeding the child? Bonding and make, really be more mindful about that.
And I think also it's helpful to have a list in your mind or written down, ideally written down so you can look at it, of maybe 5 or 6 things that make you feel better. And starting with really basic stuff, like if you notice you're not feeling like yourself, you're feeling sad or angry or whatever, have a cup of water, because often dehydration will make us moody. Have a snack with protein. Consider a shower. Change your clothes. So really basic stuff can add up to making us feel more in control, more productive. Reach out to a friend. Watch videos of puppies on the internet. Any of those things can add up slowly, but they'll add up. So having a list of go-to things that make you feel better is a great idea. And also be your own cheering squad.
Yes, important.
Yeah. I give myself a lot of compliments, and usually internally, and I think that really helps me to feel competent.
Because sometimes you don't have anyone else to do that for you.
Correct.
You have to be your own cheerleader.
Yeah, absolutely.
One thing that kind of along that lines is I like to just look up motivational videos on YouTube. And they have, cool little scenes, but just a talk, inspirational talk.
Yeah, very nice. There are a lot of great podcasts that are available too.
Yeah. Good. Well, one of the last questions that I have is about moms, parents trying to make a decision about whether we should continue with at-home learning or send our child to school.
Right.
That's a tough one, isn't it?
Yes.
I know that I just recently had to make that decision myself, and it's hard. So there's lots of factors into that. And I think it's really important that we don't judge ourselves or others in how they make that decision. Some of the factors that we need to think about is how old is our child? Is our child really young? Is it kindergarten, first grade, second grade? Or are they junior or senior in high school? What kinds of activities are they involved with at school? And will that be able to be continued right now?
Sure.
how important are those extracurricular activities to your child?
Mm-hmm.
And then just weighing out what kind of education they're getting. And how much, I think another big factor is how much work do you have to put in to helping them?
Right.
You know, children that are in high school are typically more self-sufficient, but not always. If they don't have the motivation to do school, then maybe they need to go in school to get that motivation.
Right.
I feel like going to school is really important for little ones, because we also have to recognize all of the non-academic learning that they get. So feeling disappointed that a friend didn't invite you to play, and learning how to deal with those emotions, social interaction, sitting quietly and listening. It always amazes me how kids can do that so well at school, but not at home.
True.
So practicing a lot of those skills and just that social interaction is really important, really important for their development.
I think another important question for parents to decide is how confident do you feel in what the school is doing to keep the kids safe? Their safety measures. And also how is it affecting your home life?
There's risks always, you know, so are there medically fragile people at home?
And also positives. Sometimes some of the kids are getting their work done in less time than a full school day, and that allows them time to do other things like reading or physical activities. And so some kids really thrive on the flexibility of being virtual for the day as well.
Yeah, great.
Yeah.
Okay, well, thank you so much for submitting those questions. I really enjoyed this. This is the first time I've ever done something like this, and so I was pretty nervous.
Thanks for having us. Don't hesitate to reach out to either of us if we can be helpful to you in any way, and take good care of yourselves.
Bye-bye.